Hello, everyone. Bonjour à tous. Welcome and thank you for participating in today's technical briefing, which will provide an update on the recommendations from the National Advisory Committee on Immunization, or NACI, for the AstraZeneca COVID-19 vaccine. Bienvenue à la séance de briefing technique pour donner une mise à jour sur
Welcome to this briefing session, this update provided by the National Advisory Committee on Immunization on the AstraZeneca COVID-19 vaccine.
Dr. Shelley Deeks and Dr. from NACI. They will be accompanied by Canada's Council of Chief Medical Officer of Health, represented today by Bonnie Henry from the province of British Columbia, as well as Dr. Howard New from the Public Health Agency of Canada. Today,
we will hear information provided by Dr. Shelley Deeks as well as Caroline Quash of NACI, together with the Council of the Chief Public Health Officer, represented today by Dr. Bonnie Henry, Provincial Health Officer of BC, as well as Dr. Howard No of the Public Health Office of Canada.
Let's begin today's technical briefing. Over to you, Dr. Deeks.
Thank you very much, and good afternoon, everybody. Dr. Quash and I are pleased to take you through the National Advisory Committee on Immunization's updated public health guidance on the use of AstraZeneca COVID-19 vaccine in Canada. As you know, we plan to release this guidance on Tuesday, April 20th. However, at noon on Tuesday, NACI reviewed new provincial data that provided us with further detail about COVID-19 disease risks in the context of various variants of concern and hotspots areas. We decided to postpone the release of our updated guidance to ensure our recommendations and risk-benefit analysis for the use of AstraZeneca vaccine reflected the range of COVID activity in jurisdictions. The delay was not due to any additional safety concerns around the vaccine. Most of you will know that NACI is an independent committee of experts that has for many decades provided advice to the Public Health Agency of Canada on the optimal use of vaccines authorized for use in Canada. COVID-19 vaccination is fundamental to ending the pandemic, and NACI encourages all Canadians to get vaccinated to protect themselves, their families, and their communities from illness, hospitalization, and deaths from COVID-19. As individuals make their decisions about vaccination, NACI emphasizes the importance of providing clear and transparent information that supports informed decision-making and considers both the benefits and the risks of vaccine choices. This supports vaccine confidence in the context of rapid scientific advancement, where guidance necessarily changes as new evidence emerges. Canadians should expect to see NACI modify its guidance as new data becomes available. Our analysis considers not only vaccine efficacy, that is how vaccines work in controlled conditions of scientific studies, but also their real-world effectiveness, their performance compared to other authorized and available vaccines, and the specific qualities that make a particular vaccine best suited for some populations or age groups and not for others. We also consider the feasibility of a vaccine program and apply an ethical framework in our analysis that promotes equity in the use of vaccines. It is, of course, the provincial and territorial governments that make the decision on vaccination policy in their jurisdiction and that design and deliver immunization programs. NACI's guidance supports them in making these decisions. I'm very glad that Dr. Bonnie Henry, BC's Chief Public Health Officer, joins us today. Dr. Henry can speak to the practical applications of NACI's advice in the context of provincial decision-making. Now I will take you through NACI's updated guidance on the use of AstraZeneca COVID-19 vaccine. AstraZeneca vaccine is authorized for use in Canada for adults 18 years of age and older. Health Canada has determined that it is safe and effective. In turn, in our updated NACI statement, NACI provides advice on how best to use this vaccine, considering the portfolio of COVID-19 vaccines authorized and available for use in Canada to achieve the greatest public health benefits in response to a rare but serious blood clotting condition being referred to as vaccine-induced immune thrombotic thrombocytopenia, or VITT. Recall that on March 29th, NACI recommended an immediate pause in the use of AstraZeneca vaccine in those under 55 years of age following reports of VITT in Europe. NACI made this recommendation out of an abundance of caution, while Health Canada and other global regulators investigated the association of VITT with the AstraZeneca vaccine. Provincial and territorial chief medical officers of health unanimously supported this recommendation. On April 14th, Health Canada released their safety assessment, concluding that very rare events of blood clots with low platelet levels following immunization with the AstraZeneca vaccine may be linked to the vaccine. Health Canada has reaffirmed that the benefits of the AstraZeneca vaccine outweighs the risk. Using the European and Health Canada's safety assessment and reviewing the most up-to-date domestic and international evidence and guidance on VITT, NACI weighed the benefits of AstraZeneca vaccine in protecting populations against serious complication of COVID-19 and saving lives against the risk of developing VITT. We assessed the risk of developing and dying from VITT compared to COVID-19 ICU admissions and deaths that could be prevented by receiving an early dose of the AstraZeneca vaccine. NACI's updated recommendations are also informed by Canada's rapidly changing COVID-19 epidemiology, including the circulation of variants of concern and hotspot areas, and a comprehensive analysis of ethics, equity, feasibility, and accessibility. Our analysis provides a framework that can be used by provinces and territories to assess the benefit-risk scenarios relevant to their circumstances. The public health benefit-risk analysis for the use of AstraZeneca COVID-19 vaccine may vary between jurisdictions depending on their local COVID-19 epidemiology, their local vaccine supply and logistics, and equity and acceptability considerations. In addition, these considerations may change over time. NACI continues to preferentially recommend authorized mRNA COVID-19 vaccines due to the excellent protection they provide, the absence of a safety signal of concern, and the acceptability of the vaccines by people in Canada. NACI notes that Canada has procured and is expecting enough mRNA vaccines to fully vaccinate the currently eligible Canadian population before the fall of 2021. At this time, and based on current evidence, NACI recommends that the AstraZeneca COVID-19 vaccine may be offered to individuals 30 years of age and older without contraindications if the individual does not wish to wait for an mRNA vaccine and the benefits outweigh the risk. NACI considered the timing of expected access to COVID-19 mRNA vaccines in our calculations because mRNA vaccines are an alternative to the AstraZeneca vaccine and the availability of mRNA vaccines is growing. Vaccine supply should be considered by jurisdictions as they plan their immunization program. Based on NACI's initial technical briefings to provinces and territories, jurisdictions have already begun to announce their intentions regarding the use of AstraZeneca vaccine, reflecting the pressing epidemiologic conditions within these jurisdictions. While VITT is a rare but very serious adverse event, COVID-19 is causing hospitalizations and deaths across Canada, and some jurisdictions, unfortunately, are experiencing devastating rates of illness and hospitalization, straining their capacity. In this context, balancing risks and benefits is absolutely essential to the public health response. This will not be the same in every jurisdiction. In closing, I would like to emphasize that NACI continues to analyze the data as it becomes available and continues to closely monitor the scientific evidence on VITT. We will update our guidance as new evidence becomes available. Thank you.
Alors, je vais prendre la parole, je vais le faire cette fois-ci en français. Donc, bon après-midi à tous. Le Dr Deeks et moi sommes heureuses de vous présenter la déclaration en matière de santé publique mise à jour du Comité consultatif national de l'immunisation sur l'utilisation du vaccin contre la COVID d'AstraZeneca au Canada. Comme vous le savez, nous avions l'intention de publier cette déclaration mardi le 20 avril. Toutefois, mardi à midi, le CCNI a reçu de nouvelles données provinciales qui fournissaient plus de détails sur les risques risques de la COVID-19 dans le
providing more
contexte des
information
variants
about the
préoccupants et des
risks
zones à haute
in
incidence.
COVID-19,
Nous avons donc
about
décidé de retarder la
important
publication de
variants
notre
of
mise à jour
concern and
pour
high
nous
incidence
assurer que les
rates. So we
recommandations
wish
et que
to update
l'évaluation
our
bénéfice-risque
recommendations
de
to ensure
l'utilisation du
that our
vaccin
risk-benefit
d'AstraZeneca
analysis of the
reflètent
use of the
l'épidémiologie et
AstraZeneca
l'activité
supply
de la COVID-19
reflect
présentement en
current
cours au Canada.
nature
Le
of
délai n'est
exposure to
aucunement
COVID-19 in
attribuable à des
Canada. The
préoccupations
delay
d'une
is in
acuité
no way
supplémentaire concernant le
attributable
vaccin
to our
d'AstraZeneca.
concerns about
La plupart d'entre
adverse
vous savez
effects and
déjà que le
safety of
CCNI est un
AstraZeneca.
comité d'experts
Beyond what
indépendant
we've already
qui a
discussed,
depuis de
you know that
nombreuses
NACI is
décennies
an
donné des conseils
independent
à l'Agence de la santé
organization
publique du
which has
Canada
provided
sur l'utilisation
advice
optimale des
to
vaccins
Public Health
autorisés au
Canada
Canada.
for dozens of
La
years
vaccination contre la
about the use of
COVID-19 est
vaccinations in
fondamentale
Canada.
pour mettre fin à la pandémie et
Vaccination
le
is
CCNI
essential to
encourage
put an
tous les
end to the current
Canadiens à se faire
pandemic, and
vacciner
NACI
pour se
encourages all
protéger
Canadians
et
to be
protéger leurs
vaccinated to
familles et
protect
leurs
themselves,
communautés
protect
contre
their
la
families
maladie,
and their
les
communities
hospitalisations et les
against
décès
illness,
attribuables à la COVID-19.
hospitalization, and
Pendant que
death
les gens prennent des décisions sur la
attributable to
vaccination, le
COVID-19.
CCNI
While
souligne
people are making their
l'importance de
decisions
fournir des
about
renseignements clairs
vaccinations,
et transparents
NACI
qui
underscores how
soutiennent la
important
prise
it
de
is
décisions
to
éclairées
provide
et
everyone
qui
with
sous-pèsent les bénéfices
accurate
et les risques
information,
des
up-to-date
différents vaccins
information to allow
disponibles.
people to make
Cela
effective
permet de
and
renforcer la
well-informed
confiance
decisions.
dans
This
l'utilisation
will
des
allow us
vaccins
to
dans un
increase
contexte où les données
trust in
probantes
vaccine
changent sans
use,
cesse,
especially
entraînant
given
par le fait
that
même des
relevant data is
modifications dans les
changing
recommandations. Les
and
Canadiens
brings
devraient
about
s'attendre
changes
à ce
in
que le CCNI
recommendations.
modifie ses
Canadians
déclarations
should
au fur
expect
et à
NACI
mesure
to
que de
change
nouvelles
its
données
advice
deviennent
as new
disponibles.
data becomes available.
Notre évaluation ne considère non seulement
Our
l'efficacité potentielle des
evaluation
vaccins,
covers not
mais
only
tient aussi
the
compte de la façon dont les
efficacy of
vaccins fonctionnent dans des
vaccinations,
conditions
but also the
scientifiques
way
rigoureuses.
vaccinations
Elle
work,
considère aussi
and we
leur
use
efficacité en
rigorous
situation
scientific
réelle,
approaches,
leur performance par
including
rapport à d'autres vaccins
scientific
autorisés et
analysis
disponibles
of
contre la
the
COVID-19 et
relevance
les
of
caractéristiques
vaccination, how
précises
they
qui font
work
qu'un
to
vaccin
counter
donné
COVID-19,
puisse mieux
and the
convenir à certaines
specific
populations ou
effects of
certains groupes d'âge.
vaccinations, why they may
Nous
work better
considérons
for certain
également la
populations
faisabilité
or
d'un programme
groups.
de
We
vaccination
also
et
consider
appliquons un
how
cadre de référence quant
applicable
à l'éthique
vaccination
à notre
is, and we
évaluation qui
apply
favorise
ethical
l'équité dans
standards
l'utilisation des
to
vaccins.
support fairness
Bien
in
entendu, ce sont les
vaccine
gouvernements
distribution and
provinciaux et
use.
territoriaux
Of
qui
course,
prennent les décisions
provincial
sur les
and
politiques de
territorial
vaccination au
governments are
sein
the
de
ones
leurs
making the final
administrations
decisions about
et qui conçoivent et
vaccination
mettent en
on their
œuvre les programmes
territories
de
and
vaccination.
to draw up
La
and
déclaration du
apply
CCNI les
vaccination
soutient dans leur prise
programs.
de décision.
NACI
Je
supports
suis
them
heureuse que
in
Dr.
this
Bonnie
regard.
Henry,
I'm very
administre en
happy
chef de la
that
santé publique de la
Dr.
Colombie-Britannique, se
Bonnie
joigne à nous
Henry,
aujourd'hui.
the Provincial Health
Dr. Henry
Officer
pourra
of BC,
expliquer
is with us
l'application
here
pratique
today.
des
She can
conseils du
explain to
CCNI
us the
dans le
practical
contexte de la prise de décision
applications
provinciale.
of
Je vais
NACI's
maintenant revoir la
recent
déclaration
update
du CCNI
for
sur
provincial
l'utilisation du
decision-making.
vaccin contre
I will
la
now go over
COVID-19
NACI's
d'AstraZeneca.
evidential summary
Tout
update
d'abord,
for the
le vaccin
AstraZeneca COVID-19
d'AstraZeneca est
vaccine.
autorisé au
The
Canada chez les
AstraZeneca
adultes de 18 ans et
vaccine is
plus.
authorized for
Santé
use in
Canada
Canada
établit
for
qu'il s'agit d'un
Canadian
vaccin
adults 18 years
sécuritaire
and
et
over.
efficace.
We have
De
established
notre
that it's a
côté,
safe and
la
effective
déclaration du
vaccine.
CCNI mise à jour
However,
fournit des conseils sur la
we
meilleure
do have
utilisation de ce
advice
vaccin
about the
dans le
best use
contexte
of
du
the
portefeuille de
vaccination
vaccins autorisés et disponibles
within
au Canada
the context
afin
of the
d'obtenir
use
le
of
plus
all
de bénéfices
vaccines now
possible en matière
authorized
de
for
santé
use in
publique
Canada
pour la
in order to
population
ensure that we
en
get the
réponse
best
à un
benefits
problème rare
possible
mais grave
for the
de caillots
population,
sanguins
given
appelé
a rare but
thrombocytopénie
severe
thrombotique immunitaire
adverse
induite
effect
par le
called
vaccin que
vaccine-induced
j'appellerai TIV dorénavant.
thrombotic
On se
immune
rappellera que le 29
thrombocytopenia,
mars
called
dernier,
VIPIT,
le
or
CCNI
sometimes
avait recommandé
VIT.
un arrêt
You will
immédiat de
recommend
l'utilisation
that
du vaccin contre la
recently we
COVID-19
recommended
d'AstraZeneca
immediate
pour les
pausing of the
personnes de
use of
moins de
AstraZeneca
55
in all
ans,
individuals
à la
less than
suite de cas de
55 years of
TIV
age in
rapportés en
Canada,
Europe. Le
since
CCNI a
adverse
fait
effects
cette
were reported,
recommandation par
rare though
mesure
they
de
were.
précaution
And
extrême,
this recommendation
permettant
was
ainsi à
made
Santé Canada
given
d'examiner
our wish to
l'association de
be
la TIV
extremely
avec le
careful,
vaccin d'AstraZeneca.
given the
Les
rare
médecins
but
hygiénistes
possible
en chef des provinces et
association
des
of
territoires
the
avaient
adverse
appuyé cette
effect with
décision
the
à
use of
l'unanimité.
AstraZeneca.
Le
And
14 avril
provincial health
2021,
officers supported
Santé
this
Canada
decision.
publiait son
Health
évaluation de
Canada then
l'innocuité du
published
vaccin
its
d'AstraZeneca
evaluation
et concluait que
of
le
the safety
syndrome très
profile
rare de
of
caillots sanguins
AstraZeneca and
associé à des
concluded that
niveaux
the
de
very
plaquettes sanguines
rare
basses suivant
association
l'administration
of
du
this
vaccin d'AstraZeneca
VIT adverse
pouvait être
effect
lié au
following
vaccin.
administration of
Toutefois, Santé Canada
AstraZeneca
affirmait à
could be
nouveau
linked to the
que les
AstraZeneca
bénéfices du vaccin
vaccination itself,
d'AstraZeneca
but once
l'emportaient
again
sur les risques.
stated that the
Suite à
benefits outweighed the
l'évaluation de Santé
risks.
Canada et en
Following Health Canada's evaluation and based on more recent scientific evidence, as well as data provided by Canadian and international health services, we have decided that it is important to protect the population from COVID-19 and really weigh that against the risks of developing the adverse effect, VITT,
qui pourraient être prévenus en recevant une dose précoce du vaccin d'AstraZeneca. Les recommandations mises à jour par le CCNI sont aussi fondées sur l'évolution rapide de l'épidémiologie de la COVID-19, y compris la circulation de variants préoccupants et sous surveillance rehaussée, et les zones de haute incidence, ainsi que sur l'analyse de l'éthique, l'équité, la faisabilité et l'accessibilité. Notre analyse fournit un cadre qui peut être utilisé par les provinces et territoires pour évaluer les scénarios bénéfices-risques propres à leur situation. L'évaluation bénéfices-risques en matière de santé publique pour l'utilisation du vaccin contre la COVID-19 d'AstraZeneca peut varier d'une région à l'autre selon l'épidémiologie locale de la COVID-19, l'approvisionnement en vaccins local et la logistique, et les considérations d'équité et d'acceptabilité. Ces considérations peuvent changer dans le temps. Le CCNI continue de recommander préférentiellement les vaccins à ARN messager contre la COVID-19 autorisés en raison de l'excellente protection qu'ils confèrent, de l'absence de signalements préoccupants en matière d'inocuité et de l'acceptabilité de ces vaccins par les gens qui vivent au Canada. Le CCNI souligne que le Canada s'est procuré suffisamment de vaccins à ARN messager pour vacciner toute la population canadienne actuellement admissible avant l'automne 2021. Suite à cette réévaluation et en fonction des données probantes actuelles, le CCNI recommande que le vaccin d'AstraZeneca soit offert aux personnes de 30 ans et plus sans contre-indication si la personne ne veut pas attendre de recevoir un vaccin à ARN messager et si les bénéfices l'emportent sur les risques. Le CCNI a tenu compte du calendrier prévu d'approvisionnement en vaccins à ARN messager contre la COVID-19 dans ses calculs, car le Canada a accès à des vaccins autres que celui d'AstraZeneca et que la disponibilité des vaccins à ARN messager augmente. L'approvisionnement en vaccins doit être pris en compte par les provinces et territoires dans l'élaboration de leur programme de vaccination.
Provinces and territories must take these shipments into account as they draw up their plans. Over to Dr. Bonnie Henry.
Thank you very much, and good morning or good afternoon to you. And it is my pleasure to be speaking to you today from the traditional and unceded territories of the Lekwungen-speaking peoples here in Victoria, British Columbia, now known as the Esquimalt and the Songhees First Nations. And I'm very grateful to be able to talk to you from these lands. I'm Dr. Bonnie Henry, British Columbia's Provincial Health Officer, and I'm here with my colleague, Dr. Howard New, who's the Deputy Chief Public Health Officer at the Public Health Agency of Canada. And we're here on behalf of the Council of Chief Medical Officers of Health, who are our counterparts across the provinces and territories. In many jurisdictions, we are, as you know, seeing a rapid rise in COVID-19 cases and hospitalizations in this third and most alarming phase of the pandemic that we have seen. To combat this, we need to use every tool at our disposal, including all of the vaccines that are authorized by Health Canada, along with the public health measures that we know needed to continue to be essential to individual and community protection across the country. As you know, in February, Health Canada authorized the AstraZeneca COVID-19 vaccines as safe and effective for use in Canada in adults over the age of 18. As Chief Medical Officers of Health, we have been closely following evidence over the last few weeks of the international reports of this rare but serious blood clotting condition following the use of AstraZeneca vaccine, referred to, as you know, as vaccine-induced immune thrombotic thrombocytopenia, or more easily known as VITT. Our public health advice on these rare events is informed by Health Canada's safety review, by clinical research, and by the important work done by the National Advisory Committee on Immunization and the risk-benefit analysis that they have provided. As Canada's Chief Medical Officers of Health, we are very grateful to NACI for their hard work, and we know it has been a lot of work over the last few weeks, particularly, for providing this framework for assessing COVID-19 exposure risk in order to determine the epidemiologic conditions under which each age group are most likely to benefit from this vaccine. NACI has lowered their recommendations around the age threshold and provided considerations that we will use to inform provincial, territorial, and regional public health decisions on how to best use this vaccine in our programs across the country. Given some areas of Canada are experiencing very high levels of COVID-19, with increasing pressure on our hospitals and, of course, the resultant deaths. There is the potential for surges and outbreaks as well, driven by COVID-19 variants of concern across the country. NACI advises jurisdictions to adjust the age threshold for use of AstraZeneca vaccine based on this local epidemiology. The optimal use of the AstraZeneca COVID-19 vaccine in our immunization programs across the country will also vary based on current and expected vaccine supply and the logistical considerations that we are faced with. Our overall goal continues to be focused on enabling as many people as possible to be immunized as quickly as possible against COVID-19 with a safe and effective vaccine, while ensuring that highest risk populations are prioritized. All of Canada's approved vaccines provide a high level of protection against COVID-19, and we have seen that in countries around the world. Through earlier access to vaccination, we have the opportunity to vaccinate more people faster, which protects our healthcare system right now. It reduces severe illness on a personal level, as well as in a community level, and saves lives. Of course, we remain committed to providing information to support every individual in making informed decisions on their vaccination choice. As medical health officers of health, we take vaccine safety extremely seriously and continue to make a priority in the careful design of our advice and vaccine programs. Health Canada, the Public Health Agency of Canada, NACI, and the Council of Chief Medical Officers of Health will continue to work together to examine and assess any safety concerns and take appropriate action. Our guidance will continue to be grounded in the latest available evidence, and we will continue to keep everyone in Canada informed. Thank you. And I'll now turn it over to Dr. New.
Thank you, Bonnie. Bonjour à toutes et à tous. Je suis Dr. Howard
Hello,
New,
everyone.
sous-administrateur en chef de
I'm
la
the
santé
Deputy Chief
publique
Public Health
du
Officer
Canada,
of
accompagné de
Canada,
ma collègue Dr.
and
Bonnie
with my
Henry,
colleague
médecin
here,
hygiéniste
Dr.
provincial
Bonnie
de la
Henry, who is
Colombie-Britannique.
the Provincial
Nous
Health
sommes
Officer
ici au
of
nom du
BC.
Conseil des
We are
médecins
here
hygiénistes en chef
to
du
speak
Canada. Nous
for the
constatons
deputy,
présentement dans
for the
plusieurs
Chief
régions
Public Health Officer
une
of Canada.
augmentation
We
rapide
see
du
in
nombre
many
de cas de
regions a
COVID-19
rapid
et
rise of the number of cases of
d'hospitalisation
COVID-19,
attribuables à la
as well as
troisième et plus menaçante
hospitalizations,
vague de la
given
pandémie.
this third
Afin de
and
lutter
most
contre cette
threatening wave
vague,
of the
nous
pandemic.
devons
To
utiliser
fight
tous les
it
outils
back,
à
we
notre
need to use
disposition,
all
y
the tools
compris
that
tous
we
les
have,
vaccins autorisés
included,
par Santé
including
Canada.
all the
Nous devons
vaccinations now
également
authorized by
continuer de
Health Canada.
respecter les mesures
We
de
must
santé publique
continue as
qui
well
demeurent
to
essentielles pour
respect
protéger
the
les
measures
personnes
of public
et les
health that remain
collectivités.
essential to
Comme vous
protect
le savez,
individuals
Santé
and
Canada a
communities. As
autorisé
you know,
en
Health
février
Canada has
le vaccin
authorized in February
AstraZeneca
the
pour son
AstraZeneca
innocuité et
COVID-19
son
vaccine,
efficacité
given
chez les
its
adultes au Canada.
efficacy and
En tant
its
que médecin
safety
hygiéniste
when
en chef,
used in
nous avons
adults.
suivi de près, au cours des
As
dernières
the
semaines,
Chief
les
Public
rapports
Health Officer, we
internationaux
have
faisant état
closely
des
followed
manifestations
recent
rares et
publications
sérieuses
of
de caillots
international
sanguins
reports
suivant
covering
l'administration
rare
du
but
vaccin
severe
AstraZeneca.
adverse effects
Ces manifestations sont
after
désignées par le
AstraZeneca
terme
vaccine
de
was administered,
thrombocytopénie
and they are called
immunitaire thrombotique
vaccine-induced
induite par le vaccin,
thrombotic
ou TIV.
immune
Nos conseils de santé
thrombocytopenia,
publique au sujet
or
de ces manifestations
VITT,
cliniques
or VIT for short.
inhabituelles rares sont
This
fondés sur
is
l'examen
a
de
rare
l'innocuité de Santé Canada, la recherche
situation,
clinique et l'analyse des risques et des
but
avantages
studies on it
excuse-moi,
have
du
led
Comité
to our
consultatif national de
recent
l'immunisation,
update
ou CCNI.
with the NACI, the
En
National
tant que
Advisory
médecin hygiéniste en
Committee
chef,
on
nous
Immunization.
remercions le CCNI
As the
pour
Chief
son
Public Health
travail et pour
Officer
avoir fourni un
Office,
cadre
we
pour
thank NACI for
l'évaluation
its work
du
and for
risque
providing a
d'exposition à la
framework
COVID-19
for
afin de
evaluating the
déterminer
risks
les
of exposure to
conditions
COVID-19 in order
épidémiologiques
to best
dans lesquelles
decide
certains groupes
in
d'âge
what
sont les plus
epidemiological
susceptibles de
conditions
bénéficier de ce
certain
vaccin. Le
age groups
CCNI a
are likely
abaissé
to
le seuil
benefit
d'âge
from the
et
use of
a
various
offert des
vaccines.
considérations qui
NACI
servent
has
à éclairer
offered a
les
number
décisions de
of
santé
approaches that
publique,
have helped us
provinciale, territoriale
improve
et
and
régionale
shed light
sur
on proper
l'utilisation
decision
optimale de ce
making in
vaccin
public
dans les
health
programmes
for
de
optimal use
vaccination.
of vaccinations
Étant
within
donné
a
les
full
niveaux élevés de
vaccination program.
COVID-19 et
Given
une
the high rates
augmentation
of
du nombre
COVID-19
d'hospitalisations
and
et
the
de décès
rising rate of
que connaissent certaines
hospitalizations
régions,
and deaths
et
in
étant
certain
donné le
regions of
potentiel
Canada,
de
and given
résurgence
the
et
potential
d'éclosion
of
stimulé par les variants
resurgence
préoccupants qui
and
existent partout au pays,
spread and outbreaks caused by a number of variants spreading across the country, we suggest using AstraZeneca based on the local epidemiological conditions. The optimal use of AstraZeneca to counter COVID-19 infection will vary from one place to another based on current supply of vaccinations, as well as logistical considerations, and of course the demography. We would like to allow the most Canadians possible to be vaccinated against COVID-19 as quickly as possible with safe and effective vaccinations, while ensuring that high-risk populations are treated first as a priority and receive prioritized access to vaccines. Early access to vaccination gives us a chance to vaccinate more people more quickly, protect our healthcare services, reduce risks of illness, and save lives. We wish, of course, to offer advice and information that will allow everyone to take an informed decision about vaccination. We take the safety of vaccinations very seriously. It's one of our priorities and plays into our very careful evidentiary updates. Health Canada, NACI, and the Chief Public Health Office continue to examine and evaluate all concerns reported about vaccinations to ensure their safety, and we will continue to take action based on our updated evaluations. Our evaluations are based on the most recent scientific data, and rest assured that we will continue to keep all Canadians well informed.
Merci beaucoup, Dr. New. I will now open the telephone line to questions. Please remember it's one question and one follow-up. You can ask your questions in both official languages. Donc, nous allons ouvrir la téléconférence aux questions. On vous rappelle que c'est une question de
over to questions, one question and one follow-up question, and you may put your questions in either of the two official languages. Mr. Jacob.
Thank you, merci. Please press star 1 at this time for any questions. Veuillez appuyer sur étoile 1 maintenant pour poser une question. You may cancel your question at any time by pressing star 2. Vous pouvez annuler votre question à tout moment en appuyant sur les touches étoile et 2. Our first question, notre première question est de Adam Miller from CBC News. Please go ahead. La parole est à vous.
Hi there. Ontario and Alberta recently announced cases of VITT in 2 people in their 60s. New Brunswick had a case of a person in their 30s, and Alberta's had a case of someone in their 50s. So why hasn't NACI updated its guidelines to explain that the risk of these rare blood clots can be present in all of these age groups? And are you going to recommend informed consent on the risk of VITT with this vaccine?
Thank you for that question. In the new statement, we do talk about the risk of VITT. We have used the same rate of developing VITT among all age groups. So we have considered equal risk across the age groups in our statement. In addition, we have indicated that people should have informed consent when receiving AstraZeneca vaccine, so they're aware of the potential risks of developing VITT, as well as the symptoms to be aware of. And should they choose to get the vaccine and have any of those symptoms, they should immediately follow up with a healthcare provider. In addition, we have notified healthcare practitioners of those symptoms as well, because importantly, healthcare providers need to be aware that this may occur. Thank you.
Can I add to that, just in that, as Dr. Deeks has said, it's the risk of VITT we now understand is the same across all age groups, or at least there's no reason to believe it's different. But it's the risk of COVID itself that varies by age group. We know that the older you are, the more likely you are to have more severe illness, and it's the risk of COVID that is in your community that drives the age that the benefit varies. And with all of our vaccines, informed consent is a part of all of our immunization programs, and just making sure that people are aware of this risk associated with this vaccine.
Thank you. Next question.
Sorry, I had a follow-up. We've heard reports that there may be more than 4 cases of VITT in Canada, but that's all that's been reported to date by the provinces. Can you confirm how many cases of VITT have occurred in Canada? And is there a system in place, to get this information out quickly? Because it seems like it's really of interest to Canadians and the international medical community to get this out as quickly as possible to understand more about VITT and to potentially, learn more about treatment and save lives potentially.
Sure, I can start, and then either Dr. Henry or Dr. New can follow up. There's a very robust vaccine safety surveillance system in Canada. So as of today, there have been 4 cases of confirmed VITT reported through that vaccine safety surveillance system to the Public Health Agency of Canada. And that is how, at a national level, we determine the number of cases that have been reported. Often there is you'll hear about cases that are being investigated of any reportable disease, including any vaccine safety issue. And some of those do not go on to actually be the condition of interest, this case VITT. And others will, and then they will be reported. But given the nature of this condition, there is ongoing communication across the country by a group called the Vaccine Vigilance Working Group to ensure that everybody across the country, from a public health perspective, is informed as soon as possible. That communication would also go to all of the CMOHs, or Chief Medical Officers of Health, across the country.
Yes, it's a doctor. Maybe just to tag on to what Dr. Deeks said. Yes, we have an excellent sort of national, and robust surveillance system for vaccine safety. And as Dr. Deeks alluded to, and I think Dr. Henry will also confirm, is that very good communications. So anytime there's a potential case, certainly within the individual, provincial, or territorial jurisdiction, they'll do their due diligence to investigate, to look at the results, do the necessary work in terms of follow-up laboratory tests and so on. And once obviously it meets the criteria in terms of a confirmation of that, it's reported promptly to us here at the Public Health Agency of Canada. And then, of course, as you said, obviously going public in terms of informing Canadians. So that's how the system works. But certainly the lead, I think, in terms of the investigation, the follow-up, and the confirmation is at the provincial and territorial level. And then we at the national level at the Public Health Agency get the reports in due course. Dr. Henry?
Thank you, Doctor.
Sure. I mean, just to add that we do contribute from the Public Health Agency to the international understanding of this as well. And there are many things that cause illness. When we're immunizing millions of people, you expect that there will be a certain number of people who have clotting disorders that may or may not be related to this. So there is an investigation of every single one to determine whether it actually meets the criteria for this or not. And I will also say that, this is one of the things that figures into the risk assessment that we do around COVID itself, because we know COVID can cause blood clotting in a much higher rate than the very rare things that we're seeing associated with vaccines.
Thank you, Dr. Henry. We'll move to the next question. Operator.
Thank you. The next question. La prochaine question est de Mackenzie Gray from CTV News. Please go ahead. Your line is open.
Hi there. My question's for Dr. Deeks. When you announced that it was AstraZeneca could be given to people who are 30 and older, you also said, and it's a quote, if the individual does not wish to get the mRNA vaccine, that's a reason that they should potentially be able to wait. Dr. Henry, Dr. New, every doctor in the country has been telling Canadians the entire time to get the first vaccine that is available to them. So why are you saying that people could potentially wait to get a Moderna or a Pfizer when an AstraZeneca could be available to them?
What we've said is that there should be individual choice. So we've made the recommendation that anybody who, because of the risk of the very rare risk of VITT, does not wish to receive that vaccine, they should be able to wait and receive mRNA vaccine. Ultimately, though, NACI just makes recommendations. So the vaccine policies throughout the country are decided by the provinces and territories. But that is what we have said within our statement. Just saying, Dr. Quash, if you have anything to add to that.
I mean, I think you've captured it very well, Shelley. I think the bottom line is like everything, risk-benefit analysis. So we do agree that what we want is to vaccinate Canadians as quickly as possible. However, if you are in an area where there is no COVID transmission, if you have no contact with the outside, or if you're able to shelter through public health measures, then there is a possibility to wait for the mRNA vaccine. I think that what was intended was to say, if somebody decides not to take the AstraZeneca for some reason, that person should not be put at the end of the list of the mRNA because of in terms of their priority. So priority remains priority, but if you do want to get a vaccine earlier, I think the AstraZeneca is a safe way to be protected. Thank you.
But I just don't understand why there's any conversation about potentially waiting. Like, just to go back, Dr. Henry and Dr. New, I'd like to hear your opinion on this as well. Every public health official in this country has been begging people to get vaccinated as soon as they can. So why is NACI even introducing into a conversation about potentially waiting to pick and choose a vaccine? This is precisely what Dr. Tam and Dr. New tell us every day that we should not be doing.
Yeah, no, I understand. I think that what is being said here is that depending on where you are in the priority list, if you're 60 and over, next week you could be able to get this mRNA vaccine. So it's just a matter, when we made this risk-benefit analysis, we took into account the time one would have to wait to get the mRNA vaccine. The UK used a 4-month wait. We were in terms of weeks, between 1 and 7 weeks, depending on where you were on the priority list. So that is just, we are being fully transparent, explaining exactly how we made our recommendation, and that is what was the basis for our thinking through this question. Thank you.
I'll just add to that you're absolutely right. The basis of all of our programs in this country are particularly Pfizer, because that's the vaccine that we have the most of, and the Moderna vaccines, and we have the added benefit of having AstraZeneca and hopefully soon the J&J vaccine too. And we are targeting those in most of the country to different areas, particularly hotspot areas. And because most of our programs are based on age, there are some people that are not yet eligible for the main part of the program. And the AstraZeneca is an important vaccine for us to have available, especially right now, because it protects people really well from hospitalization, from ICU, and it protects your community too. So we are still, and my counterparts across the country, when we're in this phase that we are in right now, having whatever vaccine is available to you, and we would encourage you to take that. They are all safe and effective vaccines, and we've seen real world effectiveness of both of all three of the vaccines that are available right now in Canada. We do recognize that some people will not want or will not be able to take the AstraZeneca vaccine, and they may choose to wait if they can protect themselves using public health measures. But absolutely, I encourage people to get the vaccine that is available to them first. And I can tell you members of my family have received AstraZeneca vaccine on my recommendation recently.
Thank you very much. We'll now move to the next question. Prochaine question, opérateur.
Thank you. The next question. La prochaine question est de Lauren Pelly from CBC News. Please go ahead. Your line is open.
Hi there. I know that you are obviously just recommending these changes to who can access the AstraZeneca vaccine, but I am wondering if you have any insight, these rare, serious blood clots that are occurring, How are they treated now? Have we made any progress understanding them? Can you just share a little bit on, these rare cases, as more Canadians may be getting these shots, we may see more. Do you feel that we are prepared to handle these rare instances when they happen?
Carolyn, over to you for that one.
Yeah, so I'm not sure exactly who is best placed to answer this because we are really looking at the vaccine and not the treatment. The best people are, of course, your hematologist specialized in thrombosis. From my understanding, being a pediatric infectious disease specialist, not an adult one, so not seeing that many clots in general, in terms of treatment, when we use IVIG and non-heparin anticoagulants, the outcome seems to be better. However, as you said, we're going to see more and more. I think that as we pick up those cases earlier, the outcome will be better. And as healthcare workers become more acquainted with this with this entity, the treatment used is going to be also better targeted to that, because a regular clot would be treated with heparin, and if you have very, very low platelets and at risk of bleeding, you would transfuse platelets. But it's very possible that in this particular case, these treatment would just worsen the condition. So I think that that's why making sure that our healthcare workers are absolutely knowledgeable about this entity is key to have better outcomes post-treatment. But in terms of, latest treatment discoveries for the VITT, I could not say more. Thank you.
I will just say, to echo what Karen did say, this has been another part of what we need to do to make sure that we're prepared for this. So we're putting out messages to people about what to look for, what the time frame is, and what the signs and symptoms are, so that they can get assessed and treated early. And we have a good information that's coming out from the Public Health Agency around that as well. We have a network of clinicians across the country with a key clinician in each province and territory who is working together to be able to support family docs. So it's a hematologist, somebody who's used to dealing with blood disorders, where this phenomenon has been seen from other things. We call it either autoimmune induced or heparin induced blood thrombocytopenia. So it's not an unknown entity. It is not a common entity that we see in public health or in infectious disease, but it is something the hematologists are quite familiar with. So having that network of clinicians to support the family doctors or the emerge doctors who are assessing people is really important too. But we must remember that this is rare. So that's why having some key people that anybody can talk to, any clinician can talk to if they're concerned about this condition in a patient is important.
Yes, and it's Dr. New. Maybe I'll just round out the answer with my two colleagues. You're right. Certainly myself as well, I'm not a hematologist. If I do anything clinically, it's more in the world of adult tuberculosis. So similar to Dr. Quash, I wouldn't be able to tell you about the latest treatments. But as Dr. Henry also alluded to, certainly the role of the Public Health Agency of Canada, we're sort of a facilitator convener. So we've been making the connections, recognizing there's a well-established group. I call it a community of practice among the hematologists, the specialists, the clinicians, in terms of exchanging best practices, what they're learning from each other, learning from their international colleagues. So anything we can do to help support that in terms of making sure that the right information on the latest treatments is disseminated. And also, not that everyone has to know that, but at least in terms of the connections between, as Dr. Henry said, be it family physicians on the front line, being able to connect to a specialist or hematologist who would then have that information based on their exchanges with their community of practice. I think that's the way we're obviously making sure that Canadians can be sure that the treatments are available and accessible throughout the country. Thank you.
Thank you, Dr. Any follow-up?
I also thank you for all of those answers, by the way. I just want to check as well how closely you are following the Johnson & Johnson concerns south of the border, since fairly soon we will have two vaccines being used in Canada that are both being linked to these rare blood clots. So just anything you can share on what you're looking ahead to now.
Dr. New, maybe I'll start first because I think that the process, it's sort of repeated itself a few times. So that's good, though. Certainly, I can't speak for Health Canada, but also being another, quote, a federal department, but independent as a regulator. I know that they're in close contact with their counterparts in the U.S. as well as international regulators, looking at the latest data, the safety signal, seeing what the data is in terms of the safety signal and so on. And once they have all that, they'll obviously do their own analysis and come forward with the results of their safety review. Then in turn, NACI, I know, is chomping at the bit, as they say, to obviously get that information, the results of the analysis, the safety review from Health Canada, as part of their deliberations in terms of any recommendations they would develop with respect to the use of that vaccine here in Canada. And then, of course, at the end of all that, looking at Dr. Henry, it's provinces and territories that take that all into account. They'll have seen what Health Canada has pronounced on the safety, and efficacy of the Janssen vaccine, also what the NACI will be coming forward with in terms of any recommendations, and then obviously having to take into account their local epidemiology, other contexts, other considerations, will obviously operationalize it to their best advantage.
The only thing I'd add to Dr. New's comment is that the equivalent advisory committee in the US is called ACIP, and NACI has close ties with ACIP. So as similar to NACI having meetings about vaccines in Canada, they're having ongoing meetings. So we are able to benefit from their meetings and hearing from them about some of the decisions they've made. So we will be looking at the regulatory safety conclusions, but also link in with ACIP.
Can I just say that it also is, as we are looking for this, the safety signal showed up in Europe with this vaccine, but we are looking at it with all vaccines. And I think there's a very low level that has been seen associated with a number of different vaccines. And really importantly, we have a very much higher rate of similar clotting disorders that we see with infection with COVID-19. So all of that figures into the balance as well. And I know, as Dr. Deeks was saying, ACIP is looking at J&J today even. So we'll expect to have more information from NACI soon.
Thank you. I think the end of that response cut off a little bit. We can move back over to the next question. Question, question, opérateur.
Thank you. The next question, la prochaine question est de Stephanie Taylor from the Canadian Press. Please go ahead. La parole est à vous.
Hi, this question is for Dr. Deeks, or Dr. Carolyn as well. Are you looking at making any changes to how NACI provides advice, given that it was not able to provide advice quickly to provinces, and provinces had to make a decision on their own as to how to use AstraZeneca vaccine in people younger than 55, given the spread we see currently? So does that give NACI any pause to rethink its processes or how it administers advice when it comes to vaccines?
Sure, why don't I start? And then it'd probably be good to hear from Dr. Henry as well, because you received some of the information. So NACI has been having multiple meetings on various changes that have happened with a number of the products. But we also want to ensure that any of our statements that we release are evidence-based and very thorough. Notwithstanding that, we are often on the agenda of the meetings that the Special Advisory Committee, or SAC, that is composed of all the CCMOHs across the country, and provide regular updates to the provinces and territories about where we are. So we do that informally on the various agendas, and had done that throughout this period. We had done that as did Health Canada. So the CMOHs did not need to wait till a formal NACI statement was out. What happened last week was, or this week, it just seems like it's been a long last week. We had certain information based on Canadian surveillance data, but then got more detailed information that was from a particular province that had more detailed information about and more current information about ICU admissions. So we were able to do a more fulsome analysis on Monday night. And so that is why we presented to SAC on Sunday. They heard where we were heading. And then Monday got additional data. And that actually changed the risk benefit, because this data looked more at some of the serious outcomes using the variants of concern. And so we felt it was more important to use more fulsome data and in the risk-benefit analysis, and then that would be of more use to the provinces and territories than to rush out, make a statement, and then continue the analysis and change the statement.
And I can add as well. So Matthew Tunis, Executive Secretary to the National Advisory Committee. So I work with the Public Health Agency of Canada, and I would just note that we convene the committee really as needed as evidence evolves. And in the case of the last week, NACI convened 3 or 4 times within a very short span as this information was evolving and continued to evolve. So the committee is absolutely reactive and responsive to information that's evolving. We've been seeing throughout this pandemic that every day brings a new surprise, both in terms of the COVID epidemiology, in terms of what we're seeing in the rate of this rare but serious adverse event. And so we're really trying to make sure that the committee has the ability to be responsive and reactive to the evolving situation, and find where those appropriate junctures are to brief the provinces and territories on the direction of those recommendations, and then to brief the public as soon as possible once the committee finalizes their deliberations. And I'm happy to turn to Dr. Henry if she has any additional thoughts on that relationship between the committee, who gives advice to the agency, the Public Health Agency of Canada, and then we make that available to the provinces and territories.
Yeah, as Shelley has said, and Carolyn, we meet regularly, and we feed questions that we have back into NACI to address. And I think I can speak for all of my colleagues to say that we have tremendous confidence and respect for the work that NACI does, but it is sometimes we have to make decisions based on what's happening in the provinces and territories on a rapid basis. So we use what we can, everything that we know from the interactions and the ongoing deliberations and updates from Health Canada, from what we learn from other countries. We had meetings over this past weekend with a number of other countries as well as with NACI. So sometimes it does seem like we need to get out ahead based on the urgent changes that are happening in our provinces and territories, but we do use the recommendations from the National Advisory Committee to underpin the work that we're doing. And it's a challenge. It's a really difficult period of time, and we need vaccines right now. We know that these vaccines, all of them, protect people and keep people safe and prevent transmission and keep people out of hospitals. And as our hospitals have been more and more stretched in these past few weeks, it has meant that we've had to take decisions based on the best information that we have on an ongoing basis. So the frameworks that come out of the National Advisory Committee, particularly around this specific issue, have been ones that have been very helpful for us. And then we need to make those decisions about how does that translate into the situation we're dealing with on the ground today. So it is a very important relationship that we have with the National Advisory Committee and with Health Canada to understand things as we move on.
And maybe if I may just set the timeline straight. The report from Health Canada came out on April 14th. NACI made its recommendation to the Public Health Agency of Canada over the weekend, gave that recommendation to the provinces on Sunday, which then helped the provinces make their decision based on their local epidemiology. One has to realize that once the recommendation is finalized at the NACI level, we'll still need to have it translated because Canada has 2 official languages. And we need to also web code that because we cannot post anything on the Government of Canada's web system without having it be available to visually impaired. So that adds on to the complexity. We understand that it would be very much better if we could get that publicly available before. But in terms of reactiveness and turnaround time, I think that 3 days is actually the best that a committee can do to meet consensus, because this is what we're aiming for, is a consensus of committee members. It's not an executive decision. It's really based on data and on everyone agreeing on a recommendation. Thank you.
Thanks. For a follow-up question, when can we expect NACI recommendations on how the Johnson & Johnson vaccine can be used, given the fact that we have about 300,000 doses arriving towards the end of next week, soon to be distributed to provinces and territories?
Yeah, I'll take that one if you don't mind. So that recommendation has been ready for a while. The reason why we have decided to wait was because of the signal that is currently being investigated in the US. So since ACIP is meeting today to decide what to do with this, the last thing we want is to put a recommendation out too early to have to change it again. You'll remember what happened with AstraZeneca at the beginning. You guys all told us, why didn't you not wait to see the other data before putting out your recommendation? Because we wanted to be so quick and nimble that we put out a recommendation as quickly as we could. So see, we try to learn from our previous mishaps, and this time around saying that we wouldn't have the Johnson product in use before early May. We still have 2 weeks to wait on new data to be able to put out the most up-to-date version as possible. As you know, as we said, we need to be very flexible. Data are moving daily, and we never know exactly what's coming ahead of us. But when we know, we try to be cognizant of them to really give you the best recommendation we can. Thank you.
Thank you, Dr. Quach. We have time for one more question, one last question. Opérateur.
Thank you. Merci. The next question, la prochaine question est de Christine Barak from CBC National News. Please go ahead. La parole est à vous.
Hi there. Thanks for taking my question. I understand that NACI's guidance is for the provinces and territories based on local epidemiology, but I just want to know, how should the average Canadian decide whether they should be waiting for an mRNA vaccine or not?
I can start with this. Everybody knows and feels risk and risk benefit very differently. And each of the provinces and territories have slightly different vaccine rollouts. So depending on where you are, I'm in Nova Scotia. I know when I will be eligible for a vaccine. And I also know in my situation how my own risk benefit. So people will need to look at how worried they are about COVID, how much COVID there is in the community, whether there's a vaccine available to them now, and if they want to get vaccinated now, how much they are worried about adverse events, because we all are worried about that in a slightly different way. And then they'll need to make a decision one way or another about where that risk benefit lies for them about receiving a vaccine now or waiting for a vaccine later. I think we're all of the panel is very passionate about vaccines, and we all know how important it is for Canadians to get vaccinated, as many Canadians as possible, to be vaccinated as soon as possible. But risk perception and risk tolerance is actually a very individual thing. Thanks.
And I would just add that I can say unequivocally in British Columbia, in most places in British Columbia, especially in areas where we have a lot of transmission right now of this virus, you take the vaccine that is offered to you. And they are safe, they are effective, they work, it will protect you, it'll protect your family. And my colleagues across the country who are dealing with what we're dealing with right now would say the same thing.
Thank you very much. Yeah, go ahead with your follow-up.
Question for one of my colleagues. Ontario is now prioritizing pregnant women for COVID vaccines based on evidence of severe outcomes. Is NACI updating advice on that front as well?
Yes, we are looking at that currently and are meeting on that next week. So yes, we're looking at it.
Thank you. That will be all for today's press conference. C'est ce qui m'a fait un briefing technique pour aujourd'hui. Passez une belle journée. Au revoir.
Thank you. Merci.